All right, today we're going to talk about choledochal cysts. There isn't a whole lot to know about these either. There's just a few key factors that I want you to focus in on with these. We definitely need to know what the definition of the choledochal cysts are. So if we look at choledochal, that means the biliary tree, and then cysts are we know what cysts are. So we have cysts in the biliary tree. The only thing is that these aren't, I guess, true cysts that you'd think of, like cysts on your ovaries or cysts in the liver, cysts in your thyroid. These are actually dilations of the biliary tree. And kind of like with an aortic aneurysm, when the walls weaken, the aneurysm is caused. That's kind of what's actually happening with the biliary tree. They think that the walls are weakened because there's some pancreatic juices that are refluxing back into the biliary tree. That kind of breaks down the walls a little bit, they weaken, and then they bulge out, making these cystic spaces. One of the other big things that you need to know is that there are 5 variants of choledochal cysts. There are type 1, 2, 3, 4, and 5. Type 1 is the most common, and what we see is a fusiform dilation of the common bile duct. So right as the pancreas juices kind of reflux back into that common bile duct, the wall is weakened, and we'll see kind of a bulbous circular area right where the common bile duct should be. So that's that fusiform dilation. That's the most common type that we see. The other type that gets more hype is type 5. Also has another name, Crowley's disease, and there actually is a video to follow this one that specifically covers Crowley's disease. So for our purposes, remember type 1 is the most common, that type 5 is also known as Crowley's disease, and that there are a total of 5 different variants of choledochal cysts. The incidence of choledochal cysts also matters as well. Typically, we're going to see these in females and we're going to see them in infants. If they are not diagnosed as a congenital finding, then we might see these in older patients that have a history of gallstones, pancreatitis, or cirrhosis. So let's take a look at what choledochal cysts look like on ultrasound. So in this picture, we have a choledochal cyst labeled CC right in the middle of the picture. They usually appear very anechoic, and they are going to pop up somewhere in between the pancreas head and the porta hepatis, right where that common bile duct runs. You're most likely not going to find a normal common bile duct in the area because it is that choledochal cyst that has expanded into that fusiform shape. So again, here we have the choledochal cyst. Here is another picture of the choledochal cyst. Again, that cyst is popping up in the area that we would expect the common bile duct to run. We are instead seeing a cystic structure sitting between the pancreas head and the porta hepatis.